Sexually transmitted infections, or STIs, represent a significant public health challenge. For nurses preparing for the NCLEX exam, understanding these conditions is not just about passing a test, it is a fundamental component of providing safe, effective, compassionate patient care. Patients with STIs are often vulnerable. They may feel anxious, embarrassed. Your ability to approach this topic with clinical knowledge and a non-judgmental attitude is critical. Safe practice depends on your skill in identifying risks, recognizing symptoms, and initiating the correct steps for testing and treatment. This knowledge protects individual patients from complications and helps control the spread of infection within the community. The first and most important step in assessing for STIs is taking a thorough sexual history. This conversation provides the context for any physical findings and guides your testing strategy. To make this process consistent and comprehensive, nurses should use the 5 Ps framework. This method ensures you cover all the critical areas in a structured, professional manner. The 5 Ps are partners, practices, protection, past history of STIs, pregnancy plans. Asking these questions systematically helps you identify specific risk factors. It also opens the door for important patient education on safer sex practices. Remember to always create a private, confidential environment before beginning this conversation. Let's break down the 5 Ps. First, ask about partners. This includes questions about the number of partners a patient has had recently, for example, in the last 60 to 90 days. You should also discreetly ask about the gender of their partners. This information is not about judgment. It is about understanding potential exposures. After obtaining a thorough sexual history, the next step is a focused physical assessment. This exam is guided by the patient's reported symptoms and risk factors. Your primary goal is to look for visible signs of infection. Always explain every step of the exam to build trust and reduce anxiety. Ensure good lighting. Wear gloves. Maintain the patient's privacy and dignity. Start with a general survey. Take vital signs to check for fever. Fever can indicate pelvic inflammatory disease or a primary herpes outbreak. For female patients, inspect external and internal genital structures. Inspect the external vulva. Inspect the perineum. Inspect the perianal area. Look for sores, blisters, ulcers, warts, redness, swelling. Gently separate the labia to inspect the clitoris. Inspect the urethral meatus. Inspect the vaginal opening. Note any discharge. Note the discharge color. Note the discharge consistency. Note the discharge odor. If performing a speculum exam, inspect the vaginal walls. Inspect the cervix. Watch for cervical friability or purulent discharge from the cervical OS. Chlamydia is the most frequently reported bacterial STI in the United States, caused by the bacterium Chlamydia trachomatis. It is often called a silent infection because most people, especially women, have no symptoms. Abnormal vaginal discharge, a burning sensation during urination, lower abdominal pain, discharge from the penis, painful urination, testicular swelling. The infection targets the mucous membranes of the cervix, urethra, rectum, or throat. Diagnosis is made using a highly accurate nucleic acid amplification test, or NAAT, on a urine sample or a swab from the affected site. Treatment is simple, typically with a single dose of azithromycin or a 7-day course of doxycycline. Chlamydia is a reportable disease. Gonorrhea, caused by the bacterium Neisseria gonorrhoeae, is another common bacterial STI. Like chlamydia, it can be asymptomatic, but men are more likely to show signs. A classic sign in men is a thick, purulent, pus-like discharge from the penis and significant pain with urination. Women may have increased vaginal discharge, painful urination, or vaginal bleeding between periods. Gonorrhea can infect the genitals, rectum, and throat. Diagnosis is also made with the NAAT test. Due to rising antibiotic resistance, treatment now requires dual therapy, often with an injection of ceftriaxone and an oral antibiotic like doxycycline. Gonorrhea is also a mandatory reportable disease in all states. Pelvic inflammatory disease, or PID, is not an STI itself, but a serious complication that can result from untreated STIs, most commonly chlamydia and gonorrhea. Herpes genitalis is a common and lifelong viral infection caused by the herpes simplex virus HSV type 1 HSV type 2, the virus infects nerve cells near the spine and remains dormant, leading to recurrent outbreaks. The hallmark sign is painful blisters or ulcers on the genitals, on the rectum, or on the mouth. This first episode is often the most severe: fever, body aches, swollen lymph nodes. Diagnosis is most accurate with a swab from an active lesion for PCR. Blood tests detect antibodies but can't pinpoint timing of infection. There is no cure for herpes, but antiviral medications can manage the disease effectively: acyclovir, valacyclovir, famciclovir. For frequent recurrences, providers may prescribe daily suppressive therapy, which reduces the number of outbreaks and lowers the risk of transmitting the virus to a partner. Patient education is paramount. Patients can spread the virus even when they have no visible source. This is called asymptomatic shedding. Using condoms can reduce but not eliminate transmission risk. In most regions, genital herpes is not a reportable disease. Human papillomavirus, or HPV, is the most common STI globally. There are many different types of HPV. Some types, known as low-risk types, cause condylomata acuminata, genital warts. These appear as soft, flesh-colored growths on the genitals or around the anus. Other types, high-risk HPV, can cause cellular changes leading to cancer, most notably cervical cancer in women. Most HPV infections are asymptomatic and cleared by the immune system. Diagnosis of genital warts is usually by visual inspection. Diagnosis of high-risk HPV in women is through cervical cancer screening, Pap test, HPV DNA test. Treatment for HPV is directed at the problems it causes. Genital warts can be removed with topical medications or cryotherapy. There is no cure for the virus itself. Vaccination prevents most warts and cancers. Genital warts and HPV are generally not reportable diseases, but cancer registries track HPV-related cancers. Syphilis is a complex systemic STI caused by a spiral-shaped bacterium, Treponema pallidum. If left untreated, it progresses through distinct stages: primary syphilis, a single painless chancre at the site of infection. The chancre is highly infectious, but the chancre often heals on its own. Secondary syphilis, systemic rash. Rash classically appears on the palms of the hands and on the soles of the feet. Other symptoms include fever and swollen lymph nodes. The disease can then enter a latent phase for years before potentially re-emerging as tertiary syphilis, damaging the heart and the brain and other organs. Diagnosing syphilis involves serologic blood tests. Screening is done with non-treponemal tests like the RPR or the VDRL. If this test is positive, confirm with a treponemal test like the FTA-ABS. The treatment for syphilis is penicillin G, given by injection. Dosage depends on the stage. Allergy may require desensitization, especially during pregnancy, since penicillin prevents congenital syphilis. Syphilis is a nationally notifiable disease. Prompt reporting is mandatory. Trichomoniasis is a very common STI caused by a single-celled protozoan, Trichomonas vaginalis. It primarily infects the vaginal mucosa in women and the urethra in men. In women, it often causes a frothy yellow-green vaginal discharge, often with a strong foul odor, vaginal itching, soreness, and painful urination. Many men are asymptomatic carriers. This infection increases the risk of acquiring or transmitting other STIs, including HIV. Diagnosis can be made with a NAIT or a wet mount for motile parasites. Standard treatment is a single oral dose of metronidazole or tinidazole. Crucial patient education. Avoid alcohol during and for a few days after treatment. Alcohol can cause a severe disulfiram-like reaction with nausea and vomiting. Trichomoniasis is not nationally notifiable in most areas. Check local policies. Sexually transmitted infections pose a unique and serious threat during pregnancy. Early and universal screening for STIs is a standard part of prenatal care. Untreated chlamydia and gonorrhea can lead to preterm labor, premature rupture of membranes, low birth weight. These bacteria can be transmitted during vaginal delivery, causing neonatal conjunctivitis, eye infection, pneumonia. Prompt treatment with pregnancy-safe antibiotics is essential. Treponema pallidum can cross the placenta, congenital syphilis, causing miscarriage, stillbirth, severe developmental problems, bone deformities, neurological impairment. All pregnant patients should be screened. If positive, immediate penicillin is required. A mother with an active genital herpes outbreak at delivery can transmit the virus. Cesarean delivery is typically recommended if active lesions are present. Partner notification, public health reporting, and thorough patient education complete safe nursing practice.